But imagine a way to get rid of inches of fat. When diet and exercise do not work and surgery is out of the question, there's a lot of buzz surrounding a new procedure that freezes fat off your body. Fox 5's Kathleen Bade followed one San Diego mom over 2 months to see if this fat freezing fix is true science or pure fiction.
Love handles, muffin top.
There's fat. Let's get rid of that.
You know, it's a solid love handle.
We asked Susie Piegza how long she's been battling her bulge.
I think my entire life. You can only do so much with Spanx.
The 46-year-old mother of 2 is a petite woman. She's 5'3½", weighs around 114 pounds. She eats healthy most of the time.
Yeah, love broccoli.
She has a trainer and leads an active life.
I walk my dog. I'm forever running around doing stuff with my kids, and I work full-time and I volunteer.
That's what makes her the perfect candidate for the fat-freezing procedure called CoolSculpting by Zeltique, which does not involve surgery and is way cheaper than lipo. Doctors say it works best on people who are fit but have a stubborn, pinchable layer of fat they just can't seem to get rid of, no matter how much they eat healthy and exercise.
I do know one person who had it done, and it worked great for her, and I'm pretty confident that the doctors can do that for me.
So we follow Susie to her lunchtime appointment, where she gets prepped, measured, and marked.
We're going to get rid of that, all of that hangs over your pants.
Remember this number. Susie's lower waist is 31 inches wide. Then the applicator goes on, and for an hour, a small vacuum slowly sucks in the fat to freeze. Dr. Kimberly Butterwick says now is when the magic happens.
It's cold enough that it will kill the fat cells, but not any other cells, called cryolipolysis.
Translation? Intense cold zaps the fat cells, making them self-destruct and get reabsorbed into the body. The idea comes from a research paper written in the 1970s and published in the New England Journal of Medicine. Doctors found children who sucked on popsicles a lot developed dimples because the constant cold killed fat tissue in their cheeks. In 2010, the FDA approved this method as a way to fight fat. And since then, it's been featured on shows worldwide. Okay. Back to Susie now in San Diego. An hour's up. So how does she feel?
I was fine. I could read a magazine. I could drink water.
After the treatment, it feels kind of numb and a little tender. When you push on it, it's as if you've done too many sit-ups. It's sore.
Results don't come right away. Dr. Butterwick says most patients see a change 2 to 4 months later. Susie got it done in September and says she saw a small difference after only a month.
I think it's actually working. I find myself tucking in more of my clothes and not seeing as much of a love handles.
And numbers don't lie, so we measure her again. 2 months after she got her fat frozen, her lower waist is now 29.5 inches wide. It used to be 31 inches. Susie still sticks to the same routine.
It might be a placebo effect, I'm not sure, but to me it looked like that area went down.
Susie's results are similar to the thousands of other CoolSculpting patients who reported losing inches around their waist, tummy, and even that little pocket of fat that bulges out from the bra. Now skeptics will still have their doubts, and of course everybody reacts differently, but Susie is convinced enough to want seconds.
I think it's not a replacement for working out and eating right, but I think if it's that little extra something that can help you to focus on an area that's bugging you, then I think it's a good thing to do.
The dog was doing the downward dog. Did you see that?